Mommy, I read that or?
Sir, it is live, sir. Now the session is yours.
Yeah. Okay, sir. Thank you. So, good evening, students. We are online again after a long time. So, this is just a short and sweet session, just for 20 minutes. So, you'll have a nice discussion. So, we'll go directly to the first question. Are you ready, students?
Yes, sir.
Yes,
So,
sir.
some of the students we are already, some of the questions which we are discussing now has been already discussed. So, we'll see how our memory is. Okay. So, first is, which of the following is not with helical structure? Can one of the student read the choices, please?
Double standard DNA, collagen, inosine, myosin.
Okay. So before going to the select the answer, you just see what is asked in the question. So that means which of the following is not. So most of the time we will miss that not. So which of the following is with helical structure they will read, and immediately they will put it as DNA, because DNA is a helical structure, everyone know it. So always the distractor, the most distracting distractor will be the first option. So that we have to keep it in mind. Okay. So anybody, any takers for this question?
Yeah, inosine, sir.
Inosine, sir.
Inosine. Okay. So yeah, that means all the other three are helical structures, right?
Yes, sir.
Yes, sir. Yes, sir.
So what is the dsDNA? What type of helix it is?
Alpha helix, sir.
Alpha
Helix. Okay. So what about collagen?
Triple
Triple
helix.
helix.
Triple helix. Very good. So what about inosine? What is inosine actually?
Inosine is a compound. It's a base, sir. Nitrogenous base.
Yes, nitrogen base, sir. It's a precursor of
Very good.
inosine guanine.
Very good. Very good. And what is myosin?
It's
Sir,
also a
myosin-
helical structure, sir.
Helical
So
structure.
where do you
muscle
find
protein, sir.
where do you find myosin?
This is a
Muscle.
And
muscle
what
protein.
is the other protein associated with myosin?
Actin.
Excellent, excellent. So we'll see just an explanation for this. So this is the DNA structure you all know. So who invented this DNA structure?
Watson and Crick.
Exactly, excellent, excellent. Okay, great. And this is the collagen fiber. So who discovered collagen? Structure of collagen?
Ramchandran.
Yeah, Watson and Crick is a foreigner, so you remember easily. So collagen is discovered by an Indian, so you struggle it. So that's the thing, right? So find out who discovered the collagen structure. The collagen structure is a triple helix structure, and you know the structure of benzene.
Yes, sir.
Yes,
So who
sir.
discovered the benzene structure?
Sir,
Sir, I don't know, sir.
sir, there is a story for that also, sir.
What story?
Sir, he had a dream, sir. Actually,
Yeah, yeah.
He had a dream. Actually, he was very confused with the benzene structure. How it can be C6 H6? How it can be like that?
Yeah, correct.
How can we form that double bond and those things? He was very confused. Then
Correct.
he was tired and he slept. So and in his dream, what came means six snakes came, sir. Six snakes grabbed the tail of the other snakes such that
Okay.
it formed a hexagon.
Okay.
So
So that gave him an idea. That gave him an idea. Correct.
Idea.
So exactly. So your thinking should be more during when you are sleeping, right? So even
yes,
during
sir.
sleeping, you should be thinking. Then only you can have some innovative ideas, right? So find out who is that great man who discovered the structure of benzene also, and also the person who discovered collagen structure also, and let me know in the WhatsApp group. Okay. This is inosine. You know, this benzene ring is the structure of almost all the organic compounds, right? So this is inosine. Inosine, you have got a nitrogenous base, so you already told that. And this is the myosin. So this is a myosin. You can see the myosin fibrils. So the myosin molecules, it has multiple filaments. You can see there is a head, there is a tail, and with the tail it reacts with the head it reacts with the actin and causes muscle contraction. Excellent. So we'll go to the next question. So can someone read the question? There are only 3 students, I think. Please, someone take the question.
Which of the
Hello?
following combination? Which of the following combination which of the following combination is not feasible?
Okay.
A,
Again, this is a negative question. So not, okay?
Yes, sir. Doxorubicin, flyfluorouracil, then cyclophosphamide plus vincristine, tamoxifen plus adriamycin, then 5-fluorouracil, then CALV.
Yeah. What is CA? What is
calcium,
CA?
sir?
Calcium, correct. So LV, any drug you use along with 5-fluorouracil, which starts with the calcium prefix. Calcium leucovorin. Calcium leucovorin. Yeah. So the question is a negative question. So we have to identify in which combination we cannot use. So all these drugs, these are all drugs, right? You know, all these are drugs. So all these drugs are used in treatment of cancer. So any takers for this question? Any other person? Any other person? Wild guess. Wild guess.
Don't know, sir.
Don't know. Somebody was attempting. I am not able to hear them properly. Someone was telling us.
Sir, tamoxifen, adriamycin.
Okay. So why it is tamoxifen and adriamycin? Can you elaborate on that?
Sir, tamoxifen is a selective estrogen receptor modulator, whereas adriamycin is something related to DNA, sir.
Okay. So
they don't go well. One is going against the receptor and blocking that way. Another is
so let one drug act in the receptor, let another drug act in the DNA. What is wrong in that? So what is ciprofloxacin?
So
ciprofloxacin is a fluoroquinone.
What is it? What is it? It is a cholinergic or adrenergic or what is it? What type of drug it is? Ciprofloxacin.
It is an antibiotic.
It is an antibiotic. So basically it is an antibiotic, right?
Yes,
what is erythromycin? What is erythromycin?
So
erythromycin is a macrolide.
Macrolide. So what is the basic difference between erythromycin or macrolide antibiotic and ciprofloxacin?
Mechanism action, sir.
Acts in a different manner, sir.
Yeah. So what does it cause? Or if there is a bacteria, you put ciprofloxacin, what does it cause?
It causes
protein virus inhibition, sir. That causes bactericidal drug.
What is bactericidal?
Killing of bacteria, sir.
Killing of bacteria. Which one? Which one is bactericidal?
Ciprofloxacin.
Ciprofloxacin. What about macrolide antibiotics? Is it bactericidal or something else? Virucidal.
Yeah, most of them are bacteriostatic, but erythromycin at low dose is bacteriostatic, high dose is bactericidal.
So there is something called bacteriostatic and something called bactericidal. So if you put a macrolide, most of them are bacteriostatic. So what does that mean?
Sir, they just inhibit the bacteria.
Yes.
Inhibit means what? What does it do?
Inhibit the replication. Inhibit the replication.
Stop, but they won't.
Yeah. So for example, if there are 100 bacteria, you put ciprofloxacin, it will reduce to 50, 25, or 10, and ultimately it becomes 0. If you put macrolide antibiotic or 100 sensitive bacteria, 100 bacteria are there. After some time, it will be 100 bacteria only because it is bacteriostatic. It will not allow further replication. So this is the basic difference between the two. So because there are two such things, we should not combine these two. Understood? So a bacteriostatic antibiotic and a bactericidal antibiotic, we don't combine, right?
Yes, sir.
You know that, right? You know that,
yes,
right?
Sir, yes, sir. Yes, sir.
So similarly, instead of bacteria, we have got tumor cells here. So instead of antibiotics, we use chemotherapeutic substances, chemotherapeutic drugs. So all these drugs are cyclophosphamide, 5-FU, all are chemotherapeutic drugs. So they cause tumoricidal action, tumoricidal. Like doxorubicin, so it causes cell death of the malignant cells. So similarly, cyclophosphamide. So cyclophosphamide is a it is nothing but it is a metabolite of phosphoride mustard, and it forms DNA cross-links. So this DNA cross-links eventually leads to cell death. So similarly, so this is the action of cyclophosphamide in vivo, that is inside the tumor cell. And this is the action of doxorubicin and daunorubicin. So whenever there is a doxorubicin given inside, so it goes into a reduced metabolite and it causes strand breaks in the DNA. So every chemotherapeutic drugs has its own method of action. So most of the chemotherapeutic drugs are tumoricidal. They kill the malignant cells. So this is how a doxorubicin or daunorubicin acts. So you can know these things in the mechanism of action. And similarly, there are something called as topoisomerase inhibitors. This is again, they also cause this kind of breaks. So topoisomerase is an enzyme, so that inhibits and that causes this kind of action. So most of the things they are tumoricidal. So this is 5-FU. So 5-FU is an anti-metabolite. It interacts with the metabolism pathway. So again, it causes the DUMP to TMP, that is thymidylate monophosphate, that is not formed. So this again kills the tumor cell. So almost all these cells are tumoricidal. So this is called Vinca. Vinca is this is again an alkaloid. So these are the various chemotherapeutic drugs, the method of action. So all these things, when you see, there is something common. All these things will preferentially act over a cell which is replicating, not in resting phase. So you know there is something called resting phase, synthesis phase, then mitosis phase. You know that, no?
Yes,
So there is something called interphase and the mitosis phase. So only during different phases of the mitosis, these chemotherapeutic drugs can act. So what about this tamoxifen? So tamoxifen actually causes, it inhibits it interacts with the receptor. So that receptor, if you don't give that receptor, what happens is that cell remains static. So there is no replication. So when you give tamoxifen, there is no cell replication and there is no usefulness of these chemotherapeutic drugs. This is called tumoricidal drugs. So we should never combine tamoxifen, which is a cytostatic drug, with a cytotoxic drug. Cytostatic means it doesn't allow replication, it just inhibits. And cytostatic drug, that is tamoxifen, should not be combined with the chemotherapy drugs. So why this is very important is, I can still see in many of the colleges, medical colleges and things, where house surgeons and postgraduates, after a surgery, like for example breast cancer surgery, from the first post-operative day they will give tamoxifen to the breast cancer patient, and they will tell the patient that they should not stop taking this medicine for 5 years or 10 years, like that. And after the wound healing is over, they will be referred to medical oncology or for further chemotherapy. So when the chemotherapy is being given, these patients continue to take tamoxifen because the operated surgeon or the house surgeon has told that they have to take. So what ultimately happens is, this tamoxifen inhibits the action of, or it works against the action of the tumoricidal chemotherapeutic drugs, and there is no effect for the chemotherapeutic drugs, but there will be side effects for that. So ultimately the patient doesn't get the benefit. So this has to be kept in mind, because most of them will have such a scenario. So we have to keep it in mind. Understood? So that's the idea of giving this thing. So keep it in mind. You can also see what are the different methods of action also. Okay.
Yeah,
now,
so tumoristatic and tumoricidal cannot be given together, sir.
can you repeat, please?
Yes, sir. Tumoricidal drugs cannot be given with tumoristatic. Is that the conclusion?
Yes. So for a tumoricidal drug to act, it should act in mitosis or during cell replication. So when you give a tumoristatic drug, it inhibits the cell to go into replication at all. Understood? So when it ultimately it prevents or protects the cancer cells from getting killed. So that is the idea.
Okay, sir.
Got the point?
Yes, sir.
Okay. So I think this will be the last question. So because we are again still in the COVID pandemic, with reference to cancer, so I am giving this question. One of them, please read the question, please.
Which of the following is not a risk factor for acquiring COVID-19?
Yeah. So COVID-19, we have got lot of risk factors, no? So with reference to cancer, which of the following is not a risk factor? Read the options.
A, RRT, Metastasis, obesity,
Hmm.
diabetes mellitus.
So diabetes, you didn't read it as DM, you read it as diabetes, but RRT you didn't expand it. Why?
I was doubtful, sir.
What are your
Radiotherapy.
doubts?
Radiotherapy.
Okay.
The first
So you
hour.
thought you thought it is a mistake, printing error.
No, sir. I didn't
Spello,
know the
typo.
expansion.
No, RT means radiotherapy, no?
Yes, sir.
So if such a question comes, we may think, no, metastasis. So that means they would have thinking that it is an RT, like radiotherapy. So what is RRT? Can anyone tell me?
Rational radiotherapy.
Radiotherapy. So all the other radiotherapies are irrational. You mean to say?
No, sir.
Just kidding. So RRT is nothing to do with cancer. So it is something related to nephrology. Can someone answer? Nephrology means kidney, something related to kidney. You know dialysis?
Yes, sir.
Anybody knows dialysis?
Renal replacement therapy.
Yeah, RRT means nothing but renal replacement therapy. So dialysis, after dialysis you do transplantation. This dialysis, transplantation, these are all nothing but renal replacement therapy. So kidney you have to replace, somehow you have to replace. You have to replace it with the dialysis machine, or you have to replace it with an other donor kidney. Okay, this is RRT. So now, can someone answer the question now?
Obesity, sir.
Obesity?
Obesity is a risk factor. It is a risk factor.
So again, this is a negative question. So not, okay. So obesity is a risk factor. DM or diabetes?
It is a risk factor.
Is it a risk factor? Okay. What is RRT? That is renal replacement therapy. Is it a risk factor?
That is also risk factor, sir.
Yes,
Immunotherapy, immunocompromised.
So what about metastasis? Cancer?
Sir, can be, sir, because
Yes,
some
sir.
of
It
the
can be.
So what is the answer now? So you have to select one
Metastasis,
answer.
sir.
Which one?
Metastasis, sir.
Metastasis. Okay. So metastasis means nothing but it is already cancer. So a stage 4 cancer does not increase the susceptibility or risk factor of acquiring COVID. So any kind of immunosuppressive state, it can cause COVID. Okay. So this obesity is a immunosuppressed state. DM is an immunosuppressed state. RRT, renal replacement therapy, or transplantation, all are immunosuppressed state. But metastasis per se, it is not an immunosuppressed state. Only treatment of metastasis, when the patient is under treatment, that causes immunosuppression. So this will be the most probable answer. So you have to be very careful. This is again not a risk factor. So in one question, you have learned so many things like RRT, you have learned what is meant. So in future, like in another 1 or 2 years, we will be getting lot of questions related to COVID. So whether you are interested in medicine or not, whether you are interested in microbiology or not, whether you are interested in virology or not, everybody has to be aware of various things about COVID-19, because you got a lot of vascular complications and all because of COVID-19. How this happy hypoxia comes, why does ferritin increases? Can anyone tell me why does ferritin increases in COVID?
It is an acute phase reactant, sir.
So what? There are so many acute phase reactants. Why only ferritin? Can you tell me what are the acute phase reactants you know of?
C-reactive protein.
C-reactive
CRP.
protein.
Okay. What else?
Then serum amyloid-like protein, SSA.
Okay. So why can't we see this serum amyloid-like protein, SAP, in COVID-19? Why not? Why only serum ferritin? So our learning should be like this. Why? All of you learn about what, who, okay, where, when, all these answer. But why is the thing most important question which you have to learn. So why is the question? You have to ask yourself, you have to ask each and question why this happens. So in the previous question we were discussing, the answer is tamoxifen plus adriamycin, but we should know why it is happening, why it is that the answer. Okay.
Okay.
So can anyone tell me why this happy hypoxia or whatever this COVID-19 causes this ferritin? Why doctors measure ferritin? Why not SAP or serum amyloid protein?
So
I'll give it.
increased hypoxia, so more. So
Hypoxia.
So exoprotein is stimulated, so iron is needed to make more RBCs.
Correct, correct. You are very close, correct. So the basic pathology in happy hypoxia syndrome or COVID is basically this is hypoxia which is happening at the cellular level. The RBCs are there, the hemoglobin is there, but it is not able to carry the oxygen. Understood? So it causes hypoxia. So there is something called, what is that? Cyanide poisoning. No, there are different types of hypoxia. Anemic hypoxia. What are they? Can someone tell me? 4 types of hypoxia.
Yes, sir. Anemic hypoxia, stagnant hypoxia, hypoxic hypoxia, then
cytotoxic hypoxia or histotoxic hypoxia. So
Yes,
what type of hypoxia is happy hypoxia? What type it is? Happy hypoxia, what type of hypoxia? It is a stagnant hypoxia or a histotoxic hypoxia or anemic hypoxia? What is that? What type of hypoxia?
as you mentioned, it may be cyto.
Yeah, it's mostly cyto. There is no anemia. In fact, people develop polycythemia. And ferritin is more. Ferritin is nothing but what is ferritin actually?
A storage molecule for iron.
protein, sir.
Yeah, what is the transporting molecule? Iron transporting molecule?
Transferrin.
Transferrin. Excellent. So there is lot of iron overload. The body is being told there is no oxygen. So to transport more oxygen, you produce more RBCs. So iron stores are stimulated and more iron is being absorbed. Okay. So the iron excretion is stopped. So more iron gets deposited. So the blood becomes thicker. Okay. So that's why this ferritin is also increasing. Okay. So when this ferritin increases, the thickness or the viscosity of the blood also increases. So this again causes high chance of not stagnation. It is not only stagnation, it causes more hypercoagulable state. Okay. So that is the reason why we find most of the people with lot of hypercoagulable complications like DVT or stroke or MI, myocardial infarction, or spontaneous thrombus in some arteries or veins. So that's why we tell COVID patients to have mild ambulation. Don't take strict bed rest. If you take strict bed rest, chance of DVT is high. So with this one question, we are discussing so many things. So I think we have come to the end. So it is 9:25. We have crossed 5 more minutes. So shall we call it a day?
Yes, sir.
Okay, sir, we can stop the session.
Yes.